We're now joined by Dr. Maz Ganat, who is Program Director, Urologic Oncology at Englewood Health. Good to see you, Doctor.
Good to see you, Steve, and thanks for having me on.
You got it. Let me ask you this. In the midst of this COVID crisis, this COVID pandemic, we're doing this at the end of the summer. It'll be seen after that. What is the message you want to send to people watching, listening right now when it comes to non-COVID related medical issues that need to be addressed?
So my message, and the message that my hospital is getting out to the community, is that it is now safe to come to the hospital, and we have certain measures in place to keep our patients safe. You know, initially, when the COVID surge was taking place, our emergency room, our hospital, it was packed with COVID patients, and we're essentially a COVID hospital. So for a while, we stopped doing elective procedures, and we were advising patients not to come in unless they really had to. But now that the surge is over, and thankfully our cases are under control, and we've used those techniques to flatten the curve, we've established certain protocols, and we put things in place to protect our patients. And a phenomenon that, especially in cancer care, and I'm a cancer doctor, that we see is that we don't want patients delaying their care now. And we want patients to know that it's safe to come in and get checked for the things that are important.
And that includes, I want to be clear, prostate issues are very significant. I do what I'm supposed to do, and hopefully other folks out there watching men do as well. Kidney stones, I've had some experience with kidney stones. I'm not making it about me. I'm just saying there are real issues that need to be addressed, some more serious than others. But there's a danger in putting these off and saying, I'll wait until there's a vaccine. I'll wait until COVID's done. That doesn't make sense.
Yes, definitely agree with you. And, you know, we're getting the message across to the community that, you know, if you have kidney stones, or if you have prostate issues or urinary issues, or you need screening, or you need to get checked for certain types of cancer, call your doctor and make the appointments. And, you know, we've made certain changes in the hospital to help keep our patients safe. So, you know, any patient coming to the hospital gets their temperature checked. We do a brief survey to make sure they didn't have any exposure or don't have any symptoms. Of course, everyone wears a mask. And the other thing that we've been doing is that any patient who has any type of procedure or surgery gets a COVID test before. So all these measures have helped us keep the positive rates and keep our down and keep our patients safe, but also allowing patients to come in and get the care that they need.
You know, you're up in the Bergen County area. We know Englewood Health well. They happen to be one of the healthcare organizations, one of the hospitals and the hospital systems that supports what we do. But what strikes me is that because you are where you are, and it was one of the first regions, first areas of New Jersey very hard hit, fair to say, around COVID?
Yeah, so we're very close to New York City. It is, you know, we're right over the George Washington Bridge. That's within 10 miles of New York City. And it was, you know, we were in the epicenter of this, and we were one of the first hospitals that, you know, had to deal with COVID patients, and we, you know, had to figure it out and see what we could do to help the patients and provide the best care that we can.
Let me ask you this. The whole question of safety, you talk about the masks, you talk about the temperature taking, you talk about all the other protocols. But at the same time, I want to call it the post-COVID world, because everyone is hoping and praying for a vaccine that's effective, that's accessible, that's affordable, that's distributed effectively. To what degree do you believe, Dr. Ganat, that healthcare, particularly in the world of hospitals, will be changed forever, even when there is a quote-unquote vaccine? To what degree do you believe dramatic change forever?
So I think, you know, COVID made a lot of changes, some of them negative, some of them are positive. I think, one of the positive things that came out of COVID, and I think it's here to stay, regardless of vaccine or not, is, telemedicine and the ability of being able to speak with patients and see patients as we're talking now, on Zoom or other applications. So I think that was great. And another positive thing out of COVID, which we always talk about, and our infectious disease specialists always talk about, is washing your hands, being careful in terms of spreading infections and things like that. So those are all positive things that will stay. And the one thing that I'm really proud of—
A few seconds left, go ahead.
Yeah, especially in the hospital, is how everyone came together and, the teamwork that helped us, treat patients as best as we can.
Absolutely. And on behalf of all the patients and families of patients, et cetera, thank you for the work that you and your colleagues on the front line do every day. Thank you, Dr. Ganat.
Thank you. Appreciate it.
I'm Steve Adubato. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Johnson & Johnson, TD Bank, New Jersey Sharing Network, PSC&G, the Northward Center, the Russell Berry Foundation, NJM Insurance Group, the Fidelco Group, and by the Adler Aphasia Center. Promotional support provided by AM 970 The Answer and by NorthJersey.com and Local IQ, part of the USA Today network.
The essence of the Northward Center is ingrained in our values, thoughts, and actions. What began as a storefront on Bloomfield Avenue has evolved into a life-changing community nonprofit. The mansion is steeped in tradition, but with all of its grandeur, the true essence of the Northward Center is in the people we serve. So as the Northward Center commemorates 50 years of service, let's also celebrate the many opportunities yet to come.